At last, I want to talk about the knee joint, which is the largest and the most complex joint of our body. For all the other joints, like the shoulder, the hip joints, please refer to previous slides, and you should be able to identify those 5 different items with the specific given joints. The articulating bones in our knee are patella, tibia, and femur. Please notice that there is no fibula, just like the ulna and humerus form the elbow without radius, and the radius and the carpals form our wrist, but not the ulna. Presenting at the nearby location doesn't mean it's joining the circle. Okay, so in fact, our knee are made with 3 different joints, and these 3 different joints share one single joint cavity. And those 3 different joints are femur patella joints, which is a plane joint and allowing gliding movement. And also we have 2 more joints are the lateral and medial tibial femoral joints. The tibial femoral joints connect tibia and femur. Okay, so that's how the joints is named. The lateral and medial tibial femoral joints are the joints between femoral condyle with a lateral and medial menisci of a tibia. The knee is wrapped up and stapled by capsular and extracapsular and also intracapsular ligament, which also prevent hypertension. So this picture here is a posterior view of the knee. Remember the body surface terms? What is a body area term for the posterior of the knee? Popliteal. Did you get it right? In this picture, you can see a pair of popliteal ligament, the oblique popliteal ligament, and also the arcuate popliteal ligament, which are named by the location and also the shape of the ligament. And also we have a pair of collateral ligament. If we see collateral, which means there's a pair of lateral ligament are on the lateral side, which you get a fibula and also tibial collateral ligament named by the attachment. So the tibial collateral ligament is also called a medial collateral ligament, for short is MCL. And the other one, fibula collateral ligament, is a lateral collateral ligament. You call it LCL. That's a common abbreviation used for this pair of collateral ligament. All above ligaments together with a ligamentum patella as a patellar regions are the extracapsular ligament of the knee, because they all locate at the outside of the joint capsule. Inside the knee, there are 2 more ligaments. Those are called intracapsular ligaments. The intracapsular ligaments are the anterior cruciate ligaments and posterior cruciate ligaments. So also we commonly call it as a ACL or PCL. This pair of ligaments are in knee capsule and outside the synovial cavity. It prevents the anterior-posterior displacements, and if you are a football fan or a hockey fan, you may heard about those frequently. A knee injury of the football or hockey player always include a broken ACL or broken PCL. They are the intracapsular ligaments, stable the knee, and as a result, if there's a knee become unstable or injured, that is the ligament usually will go broken first. Our knee are designed to move forward and backward. The cartilage, such as a pair of menisci and the ligaments, are arranged to prevent lateral and medial movements. So therefore, a great vertical force will damage this arrangement. So, as in this picture shows, a lateral hockey puck will tear up the MCL here, and also the medial meniscus, as well as the ACL. The 3 C's are the common injury site for the knee. Collateral ligaments, here is the MCL, and the cruciate ligament, here is the ACL, and the last one is a cartilage. In fact, most of the time those are the menisci just along the knee. In last college football season, many players break their ACL, PCL, and I believe it is mostly due to the newly increased penalty for targeting fouls. The players who target and contact defensive opponents above the shoulders will be ejected. The reason to tighten the penalty is to reduce brain injury. But however, it makes player try to target lower, and the number of knee injuries increase. So it's a sad but kind of interesting observation. If you work as a PTA later, you may find many examples like this. Alright, that is for today. Don't forget to make your chart and organize your notes in time. Bye-bye!